My name's Nicole Otto. I'm a 7th semester nursing student at Lincoln University. Today is September 14th, around 2:30 in the afternoon, and today I'm going to insert an NG tube, pass meds through the tube, and remove the tube. So let's get started. Knock, knock. Hi, my name's Nicole. I'm going to be your nurse today. I'm going to do hand hygiene, provide for privacy. Can you tell me your name and date of birth? Awesome. Compared it to his armband. Today we're going to insert an NG tube. So I'm going to make sure I have an order for this. I'm going to look at and see if there's any history of nasal surgeries, GI surgeries. I'm going to make sure they're alert and oriented. Move the bed up to working height. Place a towel, and I'm going to check the patency of their nose. Can you breathe? Breathe. I'm going to choose his right ear for today. I'm going to open my tube. First, I'm going to get my tape ready. The long one I'm going to split down the middle. I'm going to get my tube, wrap it around my hand a little bit, just make sure it's not too stiff. And then I'm going to measure. Measure from the tip of the nose to the ear, and then from the ear down to the epigastrium. And then I'm going to mark that with a little piece of tape. And I'm going to lube the tube up. I'm going to lube the first 4 inches of the tube. Going to give my patient a drink. I'm going to have him take drinks as I advance the tube. And I'm going to have you raise your hand if you need me to stop. Make sure this isn't all twisted. I'm going to have you tilt your head back, and then once I go past the oropharynx, I'm going to have you tilt your chin forward. Take a deep breath. I'm going to insert it towards the inside of the nose in a downward motion, having them take sips, and as soon as I'm past, I'm going to have them tuck their chin. Awesome. Keep having them take sips. I'm going to take this to the cheek. And now I'm going to check the placement. To check the placement, the gold standard is do an x-ray, and then I can also check the pH. So I'm going to aspirate some contents. Get my pH strip out. And then compare it, and it's less than 4, so we're in the right place. And then you can also instill air into it and listen over the xiphoid process to make sure it's in the right spot, and it is. So I'm going to finish taping it. Tape it to the bridge of the nose. cheek. And then I'm also going to safety pin it to their gown, but allow a little slack so it's not pulling. And then I'm going to go ahead and document the insertion, what size I used, and how my patient tolerated it. And now I am going to go into the med administration. So before I pass the meds, before I come in, I'm going to do my 2 med checks. I'm going to make sure that the meds are compatible, and then they can be given crushed and through the tube. So I'm going to come in. I would check the placement, but because I just inserted, I'm not going to check it right now. I'm going to verify their name and date of birth again. Awesome. And now I'm going to crush my meds. So first I'm just going to open them and put them in each cup. Going to place the first med in this little bag, and we're going to crush it. And we want it to be nice and fine so it'll dissolve well. We want to make sure we can get as much as the med as possible. Get the other one, put it in the bag, and do the same. And then I'm going to mix each of them with 20 milliliters. And stir this and dissolve it so it becomes a solution. Ideally, I would use warm water to make it dissolve a little better. Okay, and like I said, I've already checked the place. I would check the placement, but I just inserted. So I'm gonna start by flushing it with 20 milliliters. And then I'm going to get my first med. And draw it all up. And give the first med. And then I'm going to flush again. I want to flush in the beginning, between each med, and after. So I'm going to flush this med. So I just flushed that med, so I'm going to drop the next med. So I am now giving the second med. And then I want to flush again. And then I'll have my patient sit upright for the next 30 minutes and make sure it does not hook back to suction because I want this med to be absorbed. And then I would document the meds I had given and how much I had mixed with it. Clean up my area a little bit. And then now I would get new gloves, do hand hygiene, and then now we're gonna come in and remove it. And I'm gonna make sure I have an order. I want to assess their bowel sounds, make sure they have not had any tube feedings or suction in the last 30 minutes. And yep, I'm going to give them a tissue in case they need it. So I'm gonna do this. Gonna take all the tape off. I'm gonna have my patient take a deep breath, and 1, 2, 3. Check to make sure the end of the tube is intact. Clean it up. And then I will document the removal and of the tube and how they tolerated it.